we're here on day 2 of Identity Week Europe. I'm sat down now with Maria McCann, who's from the Health Service Executive. Could you tell me about your recent projects in identity management for healthcare?
I can indeed, Evie. We've had quite a few projects during COVID. The Health Identity Management Services that I'm the director of really only got into going on January 2020, just before COVID started. And at one little point before COVID started, we thought that it was actually going to go into pause because of the COVID pandemic, but it accelerated hugely during the pandemic to actually look at identity management through testing and tracing and through the vaccination programme. And within the Health Service Executive within Ireland, it was the first time that we were able to actually follow that patient flow from time of testing the whole way through to getting your results and moving forward to your vaccine, and having that support for the patient the whole way through that process if there was any missing information for data quality or for communication information as well. So we really learned a lot over the last couple of years in that space, and then moved rapidly into business as usual. So how do we actually put the identity, the unique identifier, or individual health identifier, out into different healthcare systems? And strategically we looked at our patient administration systems within hospitals and with our GPs as well, so we could actually put the identifier out into those areas. And I've done so very successfully, thank God, keep them going, keep them moving over the last number of months. We also had to look very much at the legislation that we had for the health identifiers and look at that real strong bonding of trust and organisational anxiety with the different partners and consumers we were working with around that legislation, around that governance. So a huge amount of work has been done on that foundation to help us move forward and accelerate the strategic development. So it's been a lot in that space. And we've had quite a lot of work now as well across government with digital credentials. So myself and 2 other colleagues, Gar McCreasha and Ben Clooney, have been working with our clinical colleagues and engaging with patients regarding the digital health wallet and what that would look like, and an e-health app to actually roll that out so people would have a health pass credential and be able to look at evidences and entitlements with prescriptions and view appointments, and all really interesting stuff for citizens of Ireland to actually carry around with them in their wallet. Yeah.
I want to go into more depth of that, because what is your collaboration with the government around the technologies, the infrastructures and the policies as well?
A lot. It's fantastic. So again, the Office of Government CIO, the CIO in their Barry Lowry is a massive support to us within the healthcare system. Himself and my colleague Gar work together on the COVID app. So the HSE and the Department of Health and the government work together to develop that COVID app, and the use of COVID app and the credentials within there. When we went to our senior leadership team, our CIOs, my boss across operations, and the clinical community to talk about the opportunity to use credentials in a more widened area, Barry came to that meeting with us as well and really supported the fact that across government we should be looking at the use of credentials and digital identity to support citizens of Ireland. So it's very, very top of the agenda from a government perspective and from a policy perspective. So we've been very lucky to work with such a supportive government department, and bringing in other government departments. One of the other government departments is the Department of Social Protection, who look after identity, a full stop around authentication of identity, and they also are working with us in this project as well to ensure that we use the right formats to authenticate identity, to use the digital health app as well, and doing it in a way that supports citizens always. So it's always citizen-centred, patient-centred. How can this app be made in the best way possible with the best efficiencies for us as citizens to use the health credentials we need?
And we need people power. How are you dealing with the skill set gap in driving digital transformation?
That's a big key thing for me. I'm an organisational psychologist. People driving digital transformation is genuinely my passion. Across the last number of years, we've looked at that skills gap from a digital perspective and the change that comes with digital transformation from an emotional perspective, from a behaviour perspective, and from that skills perspective. Internally, we've looked at different collaborations with different government departments and different departments within the HSE to assess the skills level within the HSE for the digital transformations that are coming. And right from the lowest level, and I don't mean that disrespectfully, but like foundational levels of actual digital skills, and supporting the different people across the HSE whose jobs have been really focused in different areas are now starting to slightly change. So how do we support our amazing colleagues to actually have these new skill sets within digital? What does that look like? And we've created quite a few programs around that. Another area we've looked at is around collaboration around data quality. Huge passion of ours as well, because the higher the quality of the data that we actually receive for demographic data to safely identify you, the more unique identifiers we can send out, and it just makes the process for identification for us as citizens a much smoother process. So that data quality support that people need to understand, why do you need those standards? What is the governance? How do you get advice on the different legislations that's available? And to support our colleagues, again, amazing colleagues through the HSE, to find the right routes to do that. We've ran a couple of really cool events called Data Collaborathons, where the first one we opened up very much to only HSE employees and made it a very psychologically safe environment for them to come in and really tell us what your challenge is, why doesn't it work, what information do you need, what are we not doing right to support you, what do you need from us to actually support you in that area. And we thought maybe there might be about 30 people would come to it, and there was nearly 200 that actually ended up being interested, and we were really shocked. We were like, oh my God. But people are very data literate and very aware of the power and the empowerment that having good data can do for us across the system. So we'll be doing more of them.
And how digital identity is very relevant for healthcare. We've had a few sessions at the event. It's really good to speak to you. Thank you very much.
Thank you.